Welcome in. You're listening to Medical Spa Insider, presented by the American Med Spa Association. We are happy to have you with us. This week, AmSpa founder Alex Tiersch welcomes our friend Sheila Barbarino for a conversation about where the medical aesthetics space is heading and how female leadership is helping shape that future. And if you want to be a leader in the aesthetics field, learn about AmSpa member benefits at americanmedspa.org/benefits.
Everybody, welcome to the program. Alex Tiersch coming at you, and we have the amazing, lovely, and talented Dr. Sheila Barbarino coming to us from, gosh, where are you right now? I know you're all over the place. You're in Austin. Okay, awesome. And
Austin, yes. Gotcha. Earlier in the week, I was in LA, and then I was in Vienna the day before that. So
really? Now, what was going on in Vienna?
That was a Baji. We went to the Chroma headquarters and watched them their new filler, Chic, that's going to be hopefully launching in the United States in the next 2 months.
That's amazing. You're like an international player. You're like Jay-Z. You're like the Jay-Z of the plastics world. That's amazing.
I like to think of myself as more Beyonce. No, just kidding.
Well, that is actually true, except I'm not sure. Has she ever characterized herself as an international player? Maybe. I'm not sure. We'll have to look into it. I'll have my people look at that. But anyway,
does Jay-Z call himself an international player?
Yeah, he totally does. Yeah, back in the day. It's been a while. I mean, he's after he's been with Beyonce.
I'm Jay-Z.
He's calmed down a bit since he's, had kids and settled down. So I'm not sure about it, but hey, listen, I appreciate you joining Medical Spa Insider, and we're very, very lucky to have you with your busy schedule. You're obviously running around. You're very important. You've got lots of things to do. It's very difficult to pin
So are you. So are you.
Not as important, but I appreciate the sentiment. And we just got back not too long ago from Medical Spa Show. You were on we were just talking about this before we jumped on. You were on the hottest of panels that we had at the beginning during general session in front of the entire conference. We had, I want to say we had 1,500 or so folks in there watching, and really probably one of the best panels we've had about PD, GF and regenerative medicine, and everyone got into it. It was quite hot. I mean, what's your thoughts on that and the whole show? Did you have a good time? I think was it your first time being to Medical Spa Show?
No, that was like my third time. Yeah, it was my first time opening up with you.
I was just testing you to make sure you remember.
No, it's always an honor to share the stage with you, but AmSpa is different than other shows, and the reason why it's different than other shows is because I think that it's one show that actually focuses on the medical legal aspects of what we do, which we all need to be aware of, and most of us aren't, right? And it's so interesting because we do our craft and we treat our patients and we love our patients, and we even if we know how to run a business, we can't possibly know the medical legal aspect as well as we should. And that's what I think your conference itself really addresses. And I think it's something that all of us need to know more about as we practice day to day. It's so funny. There's the personal persona and there's my professional persona, right? And I always tell my staff and my patients, or I tell my staff, you never be in a room with a patient alone. Period. And there was an incident at school where my son's, my best friend's daughter got pulled into a room with a teacher by herself. And I'm like, never, ever, ever, ever go into a room by yourself, period.
Yeah.
Because anybody can say anything, anybody can do anything. And even if something didn't happen or anything wasn't said, things can be said. And, so I always tell my staff, and I say to them, I should never be in a room with anybody, including my staff, by myself, period.
I like it. And
in today's,
let's land that airplane and bring that back to what does that have to do with what we were talking about? I'm just curious with MSS.
I think that the medical legal aspect of medicine, we don't drive home enough because you don't realize that one silly whatever one-off
Yes.
thing you do on the daily can get you sued and take your license and ruin your entire life. And
And that's so
that's
important. That's
where
so
I was
true.
going with
That's so
that,
true.
right?
That's so true. That's so true. And it happens more than you think.
That's what I'm saying, right?
Especially in this industry when there's a lot of, I say it with love and I say this all the time. There's some real batshit crazy people in, from the patients to the, and not a lot, but there's some that just,
No, there's a lot. There's a
oh,
lot. And they
oh,
hide
okay.
it. They
Yeah.
hide crazy
Yeah.
people, don't think they're
Yeah.
crazy, right?
Yeah. They don't, they have no idea. They think they're right and you can't argue with them. So that's really good advice. That's really good advice. Well, so one thing I love about you and your practice particularly is, you're very, I don't want to say it's cutting edge because that's not the right word, but you're,
It is. Yeah, I am cutting edge. I am
well, I
cutting
mean,
edge.
yeah, okay. So that's right. So you're cutting edge, but you're also, but what I didn't want to, that's not what I meant. What I meant is that you're because you back it up by the research and the, you're always traveling, looking at the new things, researching the new things. You're always at the forefront of what's going on. Just get back from Vienna, you're doing these different things, and to me that's really exciting. And I think, one of the things I was talking to a lot of folks about when we were in Vegas was how do we move that more forward in the medical spa space where we can get folks doing that. Like, how do we really push the envelope a little bit? So I'm curious, what's next on the docket for you? Like, what are you looking forward to? We've spent a lot of time looking backwards and there's some squabbling going on, but like, what's exciting to you right now? What are you looking forward to
So,
this year?
so we can springboard from our panel in, Vegas. God, it feels like forever ago now, but it was only
I
really,
know.
a month ago?
Yeah, a month. Exactly a
Like,
month.
one of the discussions we had on stage was how the FDA regulates very hard in the United States, and they really regulate for safety and all of these things. But the problem is our space is so constantly evolving and constantly getting better and bringing in new technology and new tools and new products and all of these things that it really can't keep up,
Yeah.
right? Because
Yeah.
it just, the process that they go through for, checks and balances and safety, there's no way you can do that in a shorter period of time. And so that's what's unfortunate. So the United States, because of this, is behind in aesthetics, right? And that's why, you have to be inspired to go outside the United States to see what's going outside of the United States, because they're really leading the industry because they can get things through their process quicker. So there are a lot of products that people have been using for years and years and years outside the United States that are great that we're still waiting for to get FDA approval here in the United States, which is, again, unfortunate. And in my practice, I always want patients to feel and me to know in my heart of hearts that anybody that gets a treatment here, they're not going to get a treatment better anywhere else, whether they fly to Turkey or Korea or Japan, wherever they go. I've got it here to treat them in the best way possible. I can maybe not get the equivalent product because it's not FDA approved here in the United States, but the technique, delivery system, all of these things I can do, because I am very invested in learning all of the new technology and products. So things that I'm excited for this year, a lot of the international companies have invested in really getting their products here in the United States, which is fantastic because all the products that we've heard about for years in the international sector that everyone loves and uses every day, we're eventually going to be able to get them here. Galderma is launching Ralph Fides, hopefully in the next couple of months. It's going to be the most biologically active neurotoxin on the market, which is very exciting. It's going to be pre-diluted. It comes as it is, and you can just draw it out of the bottle and inject your patient, which is,
and real quick, when you say the most biologically active, what do you mean by that? What does that do? What's the impact?
What does that mean?
Yeah, well, for me, and I'm not. I mean, yeah, I
right? Biologically active. What does that mean? It means that when it so, the process of botulinum toxin A, when it enters the body and it cleaves the SNAP25, it is it's very active in the neuromuscular receptor.
Right.
Very loose to be very active and be very aggressive in the uptake.
Gotcha.
In the presynaptic cleft. So it's very exciting, theoretically, when you think about the science behind it. So is it going to work much different than the other neurotoxins? It's going to still go through the same process that we know botulinum toxin A does, but like I said, only quicker, faster, like more penetration is what I take from the studies. But again, the company isn't claiming that. I'm not saying it's going to last longer. I'm not going to say it's less better, but like I said, if we can get a neurotoxin that is more readily available to the body, I think that's in itself exciting.
Gotcha. That's awesome. All right.
Great.
Well,
very cool. Right?
Yeah, I like it. What else? I mean, there's got to be more. What else are you teasing?
There's lots of things. There's I feel like skin tightening has never really been a real thing. And there's a lot of devices that from Italy that are coming into the market that are, finally really generally tightening skin. I think I've tried every, thing under the sun to tighten skin. And right now we really need it because of the GLP-1s, and patients are seeing that skin laxity all over their body. And they really, the last thing you want to do is be a doctor who takes away a problem. Like, no, you're no longer fat, but now you have lax skin, right? So, sucks to be you, right? So that's not a good doctor, right? So we have to be able to treat them, post GLP-1s. And now we finally have great machines and great devices that do it.
Yeah. And how do you, like, when you travel overseas to Europe, Asia, wherever it might be, and you see their processes for approving and they're treating patients. And we had this conversation, I think, when we were in Vegas a little bit before the panel. There's a reason that the FDA is as slow as it is, and restrictive, good, bad, or indifferent. You can argue.
I would say 50-50. Sometimes I think they drag their feet a little bit.
Do they? Okay.
No offense.
No. Maybe that, and that's kind of what I'm getting at. I mean, I think is it solely because we're super careful? There's two parts of it. One is, are we too careful, and other countries not careful enough, where they're being a little bit reckless? Okay.
Please I think explain. Common sense isn't. I don't think common sense isn't very common, and I think that the FDA has to be well versed in so many, urology, oncology, dermatology, so they have to be so broad that they don't understand the intricacies of today's approvals, right? So, like, for instance, I did a lip study, an FDA lip study with a lip filler, and they came back to me. They said, Dr. Barbarino, great, you're going to be one of the PIs for the study. Who's your ophthalmologist on call in case there's a vascular occlusion and there's a case of blindness? And I was like, guess what? I'm an ophthalmologist too. And I wrote a paper on, how to treat blindness if you, in fact, have this unfortunate event happen to your patient. And they're like, yeah, that's not good enough. And I'm like, no, I'm a twofer. Like, I'm comfortable with the eye and I'm at the injector. And they're like, not going to cut it. And I called the retina guys down the street and I said, hey, will you guys be my backup for an FDA study? I explained to them and they're like, yes, but Dr. B, you know that we send all of that to you when it comes to us.
So it's,
right?
Yeah.
And so you could see why it's hard on both sides. Right? It's hard for me to convince them, and then they just don't understand, what that means, right?
Yeah. And that's frustrating. The other thing with the FDA that gets me is just the cost. Like it really, the cost involved in approvals it's prohibitive, really, for a lot of folks. So you have to have.
Yes, it's prohibited. So any company that isn't going to make an exorbitant, and that's the reason why, think about China and all these other places that have like so many clinics and they have so many injectors, they have so many doctors, all this. Why are we the number one market? The reason why we're the number one market is because the markup on our products are so high because of the FDA approvals, because they have to spend $100 million to get a product through, right? So some of these companies that don't have $100 million to spare to get their product FDA approved in the United States, they're never going to get approval, right? Even though it's a good product, even though it works well, even if it's going to be fantastic and be life changing in the aesthetic field, it can't get through because they don't have the budget.
Yeah. Yeah. It's tough. I mean, so here's the my question for you, Dr. Barbarino, is put your hat on for you're in charge for a day. What's the answer? Like, prescribe for us as a system. How do we make this work
That's
so
an
that we
interesting question, Alex. Like let's solve all the world's problems today. That's a good
yeah.
world
Well,
hunger. Let's end the war.
well, so we're not going to get that deep today, but
I see,
let's
I see what you're saying, but here's, so maybe I think maybe what they should do is maybe get, when they do these calls, they do them over Zoom and they always have like a company representative. They have three of them. And then they'll usually have like a medical director of some sort on, the company side. But maybe on the FDA side, they should have a medical director for maybe, or medical representative for each field, right? So like when they're doing an oncology drug, maybe they get an oncologist that they like to work with, or an aesthetic doctor that they respect, a plastic surgeon that they want to be, so they can be part of the conversation, because I think that that's the only way that, I mean, they can't be well versed in every single specialty to the nuances, right?
right.
So I think it'd be really helpful if they had someone that was like, hey, so this is safe because of this, and I think that they also miss the mark sometimes on like certain blind spots too, right? Because they don't have a medical specialist on the FDA panel.
And have you ever, I guess on the flip side, have you ever, are there treatments that you see either in Europe, Italy, where they have the energy devices are everywhere, or Asia, where you're like, I'm kind of glad that's not here in the States. Like anything where it's been like, that probably needs more testing before we can.
All the time, all the
Yeah.
time. So every single thing that I use or speak for, I actually use in my clinic, or I've tried. And I'll be honest, I try everything just to see. And I can honestly say, like, it's 50-50. Like, there's a lot of products that I'm like, that didn't do diddly squat. And then,
Yeah.
and then there are also machines that I've tried and I'm like, yeah, it did great results. I'm not going to do this because I don't like doing it. It's messy. It's painful. It took too long to do. It took up a room. My patients would never be okay wearing a garment like that. Like all of these things kind of help me make my decision making. But I think that in general, everybody in medicine wants to do good. I know everybody's like, oh, everybody's so money hungry, but like, I don't think anybody starts off like that. I think everybody wants, to genuinely, improve outcomes. I started off with, like, for one instance, there's this one skin tightening machine that I um, used to use, and it does work. It's great, but it was only had one wavelength. And now this Italian company, it's a dual wavelength. And I think that actually is much more impactful as far as skin tightening, right? And you know, what I also like about it is easier to use, and the fiber that actually goes inside the skin to tighten, it doesn't break and crumble like the other one did, and I don't need this like cannula thing that you needed for the other one. So like all of these things come into my kind of when I'm factoring whether or not I'm actually going to use this technology, and then there are people that don't want like a hole in their skin, to like, obviously it's like, an 18 gauge needle. So it's not, it closes up right away. But some people are like, that freaks me out to have, a fiber underneath my skin. So then I'll go to like a non-invasive machine, like, the T-shape or Artemis or something that tightens the skin, or radio frequency, like Wonder Touch, or, there's so many great machines now that everybody wants great results, zero downtime, and it should be not painful. Right.
Yeah.
And the greatest part about our sector, our world, is that everybody's in for those three things, right? So everybody's working towards like delivering that as a result.
Yeah. That's so
which
easy.
is no problem. Surgical results are not the surgery, right?
Yeah.
As a surgeon, I never promise that. I always say, here's good, better, best results, right? But there are things that we've been able to do now that we've never been able to do before. And I think that what we're seeing in general is what we've always kind of known, is that we wanted to treat the patient holistically, right? Between, the integrative medicine stuff, right? Like we want their wellness to be and their hormones to be in check. We want, the peptides to be, flowing and all of those things.
Yeah.
But, as a surgeon, when I was trained, way back, way long ago, right? Let's not count
That
years,
was like 2010, I thought, right?
It's really funny. My new hire was my intern, and I love her, Avery. She told me when she was born, the year she was born, Avery, where are you? Is the day that I graduated from medical school.
Oh, yeah. How does that make you feel?
Old as shit. Avery, come here. Look, shit. When were you born?
5.
Oh boy. How about that?
How weird is that? Yeah,
Well,
I was graduated and I was an intern running around New York.
That is, it comes full circle. And someday,
Right?
Someday she'll be doing her own podcast, and
hopefully she'll want my old ass on it, right?
She'll probably live to be 140 or something. So,
but that's the thing, right? And she'll look like she's 20, right? And
I hope so.
To come full circle is that surgery. You can no longer be a surgeon that only offers surgery. You've got to be able to treat the skin. You've got to be able to treat the hair growth. You've got to be able to do everything. The one thing that I was talking to Drew about is that I do. At the end of the day, I'm oculofacial plastics, right? So I do a lot of face lifts, and I do a lot of eyes and brow lifts. And one thing that I've added to my repertoire of what people need to get, not only do they need their arnica, not only do they need their eye cream and their retinols and their vitamin C and sunscreen, but they also need their brow growth and eyelash growth, and their hair serum, to help, their stress A vitamins. They need all of that, because if they're bald and they have a great face, who cares?
Yeah. Well, I mean, some people like the bald look.
It is a look, but it's a choice, right? So if they want to be bald, that's one thing. But if they are, not balding by choice, then we can have
that's true.
Options.
That's absolutely true. Well, I mean, I could talk to you all day, obviously, and we'll have to come to your practice and check it out and do like a special on your med spa, and then we can talk to Avery too and get the true story about how she really feels.
Avery better not say anything. Nothing. I'm just kidding. I beat them in the corner when they're not looking.
I'm sure that's not
one
true.
thing that I wanted to bring up, Alex, before we were on, one thing that we've really seen the dynamic that's changed, and I think that you've been super supportive of that, and I wanted to thank you. In the past, and we've seen a lot of changes in medicine. It used to be an all men's world, and now it's certainly not the case. It's there was a time that it was like we're equals, and now I feel like with assistance of supporters like you and other people, that now women are leading the pack, and I think that's something that
certainly in medical aesthetics. There's no question. I mean, I'm not sure how, like in plastic surgery and surgery, I'm not sure where it still stands. Is it still, because back when I started 2007, 8, like was dominated by men. Is it still that way in surgery?
Surgical field still is.
Okay.
It's still, but like I said, with supporters like you, I think we certainly have risen and been able to, challenge our peers. And certainly, I think it must be really hard for them to be in this aesthetics world, right? Because, they don't know what it's like. A lot of men don't know what it's like to wake up and be very vain in the morning, and want to look really pretty, right? And I think that that's really hard for any surgeon to understand that, and I think that when I see my female patients, I think my advantage that I offer them is that I understand how bad it sucks to wake up and feel like you don't want to take a picture from the side because of, your neck. And so I think that
you're right. And I think, the one thing, and I want to do this, obviously we need all the support needs to be done the right way, but I feel like it needs to be celebrated and promoted more, because in this industry, non-surgical medical aesthetics, it really is. It's 70-80% owned and dominated by women. The patients are women. The executives are women. It's really cool. It's like, and I think you're right. There's probably a lot of, even we're seeing a lot of the private equity execs that are coming in, they're run by women as well. It's kind of,
right.
It's everything. So I don't know. I think there's not enough attention paid to it, because it's, it's thriving. It's a thriving business industry that's being totally and completely run and dominated by women. So
I love it. And you've been supportive with your Wallach meeting. And like I said, we've talked about it. I think we should have, little mini ones, or, something else we can
for sure.
encourage.
We definitely will.
All of us to support each other instead of tear each other down, because, women supporting women are very powerful.
Yeah, I agree. It's cool. It's been really cool to see. Well, all right, We'll have to have you back, or we'll come see you. And I know you're busy jet setting around the world, like Jay-Z Beyonce, Jay Beyonce.
Jay Beyonce. What's so funny is my everyone has a resolution. Was this year was I was not going to be, I was going to pull back a little bit. But then
how's that going for you?
Yeah, no, not at all. The aesthetic space has gotten so, it's so funny because I feel like everyone kind of cut their budgets from last year. So I thought they were going to slow down this year, and been the exact opposite.
Yeah. Everyone says that. Yeah, I agree. Then you have to pick and choose, and you end up with the same problem. So I agree.
It's a good problem to have.
It is. Well, and you're sought after. So, and we'll do more together, because I think you've got an important voice, and I think we need to make sure that we have to bring together the whole, we have to bring together the RNs and the nurse practitioners and the PAs and everybody together, because we're all in this
together.
So I appreciate it, though. Thank you so much for joining us. And
thank you, Alan.
We'll definitely pop back and check in again real soon. And Avery too.
Sounds good.
I want to talk more about that.
Yes. All right. I'll talk to you soon.
Thank you.
Thank you for having me.
Thank you to our producer, Madeline Moeller, marketing content coordinator, who organizes the podcast schedule and guests and provides topics and talking points. Audio and video editing, voiceover, graphics, and platform management is provided by myself, Derek Hawk, digital marketing supervisor. Our themes are provided by Maka Music. Thank you for watching or listening to the Medical Spa Insider podcast. Please follow or subscribe wherever you listen to your podcast, and subscribe to our YouTube channel for future episodes. Ratings and reviews are greatly appreciated. For more information about the American Med Spa Association, visit americanmedspa.org. Reference to any specific product or entity does not constitute an endorsement or recommendation by AmSpa. Views expressed by guests are their own, and their appearance in the program does not imply an endorsement of them or any entity that they represent. AmSpa provides this podcast as a full service for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Please consult with an attorney on your legal issues. And as always, thank you for listening to the Medical Spa Insider. Remember, compliance is cool.